This fall, H1N1 hit hard and fast here in northeast Indiana.
One person in Allen County died last week, bringing the state death total to 12, according to Allen County's health department. Well, tonight, News Channel 15's Alyssa Ivinson continues her special report, Faces of the Flu, and discovers where the flu is headed next.
Across the state, H1N1 infection is approaching historic levels. But are we nearing the end of the outbreak? Tonight, we look at the future of the flu.
Every death is a loss, and it's a loss to a lot of people.
This kind of came on very quickly and a little bit early.
Everyone has somebody that this is going to create a vacuum for.
The H1N1 flu hit fast this fall.
The issue today is that we've just been seeing probably 5 times as many influenza-type patients as we normally would see in the normal flu season.
The latest report from the State Department of Health shows almost 60% of reporting hospitals say the number of flu-related hospitalizations is higher than past flu seasons. More than 10% of patients going to the doctor have the flu. That almost surpasses a 20-year state record.
For a month of October to have this type of activity is unprecedented.
Seasonal flu usually hits in the winter, but this fall outbreak of H1N1 is swamping ERs.
It came on really over the course of about 3 to 5 days. Our volume just really ramped up, and so we were able to make some changes pretty effectively, and we increased our staff, as I said, and we set up a special area for those patients to keep them isolated.
While the infection rate for H1N1 is high, the death rate so far in Indiana isn't as bad as seasonal flu.
The smaller number of deaths and the larger number of people that are infected, that means our case fatality ratio is much, much lower than what we typically see with seasonal influenza.
Around 700 to 800 people die in Indiana every year from seasonal flu, but most of those happen in the winter. And it's too early to tell what H1N1 will do when typical flu season weather rolls around.
We don't know what the winter's going to bring, which is typically when things peak.
Health officials expect seasonal flu to come as usual. But are we nearing the end of the H1N1 outbreak? There are mixed answers. Dr. Gutwein says Parkview's numbers leveled off.
I think that probably in the next, at the most 3 to 4 weeks, it'll be down significantly, and then we may see another spike in the springtime.
The Allen County Health Department says ER visits in the county went down last week compared with the previous week. But across the state, different areas could be seeing different scenarios.
There may be periodic increases and decreases in activity, especially locally. But on a statewide level, we continue to see increasing levels of influenza activity.
Well, I wish I had a crystal ball. It may well begin to taper and drop down, and then we may see another wave in the wintertime.
Lutheran Health Network also saw a surge of patients in the ER. The middle of October was up 30 to 50% from the beginning of the month. But some good news could be that last week that surge leveled off. Alyssa Ivinson, News Channel.